Hi guys, the Prime Minister along with the Health Secretary Wes Streeting met with NHS staff to speak about what they're calling a reimagined NHS. The aim of these is to bring GPs, district nurses, care workers and other medical staff together in one location, making it easier for patients to receive comprehensive care, but also care closer to home. This is to move the focus, it seems, away from NHS hospitals and towards the community. Now, Starmer described most of the problems the NHS is struggling with over the last number of years, but left out one. Can you guess what it is?
I know that the last 14 years have been really, really hard. We've had austerity, we haven't had the right money and resources, we've had a reorganisation of the NHS that made no sense and made things worse, then had the burden of COVID, and everything that followed after that. And frankly, you deserve a lot better than that. And I know that when the waiting lists are so high, that has an effect on the morale of every single person working in the NHS who are doing their level best, but sort of really up against it. And I think that's the context in which this 10-year plan has to be seen, because this is a government that's not just come in to say thank you, as we rightly do, for what you're doing. It's not just a government that comes in and says we're going to get the NHS back on its feet, is exactly what you would expect. But we want to go further than that. We want to make sure that under this Labour government, the NHS isn't just working a little bit better than it is now. We all want that. Everybody is entitled to that. We want an NHS which is reimagined, made fit for the future, so that we can be as proud as we are. Every time there's the anniversary of the NHS being set up, all of us, myself included, are really proud of the 70, 75, however many extra years now on top of that the NHS has been going. We look back with great pride at that post-war Labour government that set up the NHS. What we want to achieve is a situation where we reimagine the NHS, make it fit for the future, and where in 10, 20, 30 years people look back at what we did and say that was the government, that government of 2024, that Labour government, that made sure the NHS is fit for the next 75 years. And we want you to be part of that, not just because you're working within the NHS, but of course because you will have the best ideas.
Now, he goes on to say, which is a good thing, that he would like, or the NHS would like, the input of its staff. People who work in the system should be consulted, and I think that's a very good idea. Now, I want to get back to the point that, you know, the elephant in the room that he refuses to acknowledge: freedom of movement. The Tories and their Brexit ended freedom of movement, and of course this had a huge impact on the NHS. Thousands of doctors, nurses and other staff left. Now, what he's talking about also here is these community hubs or neighbourhood hubs, which is a great idea. But once again, we come back to the problem of freedom of movement. Is there the staff available to work in these hubs? Now, how do these hubs operate? Well, I think it's a bit like what's happening in Italy, where you have a clinic or a medical centre where instead of going to the hospital or going to your GP, you can access a whole range of services like blood tests and certain other medical tests. There's also, for example, mental health support there. So there's a whole range of services available, more than you'd access at a GP, but less than you'd access at a hospital. So this, of course, takes pressure off the NHS and it takes pressure off GPs, which is a good thing. You know, the NHS has to change, perhaps. You know, the population is changing, demographics are changing. There's more stress, for example, on the care sector. The NHS can't be expected to provide social care. It has to focus on health, but there's also preventative measures that can be taken as well, which will, of course, take pressure off the NHS. So some changes need to take place, of course. But once again, we come back to this point, and I'm not trying to reinforce this point just because it's Brexit, but because if you want to introduce new services like this, you need staff. And you can't take staff away from the NHS, from hospitals. Those hospitals already need those workers and those professionals. So how are you going to deal with that? You're going to have to change the visa system. You're going to have to try and bring back something like freedom of movement. Because if you don't, you're not going to have the staff necessary to run these hubs, and you're not going to be able to provide the services that you're promising. And then, of course, come the next election, the public will look around and say, well, things have not improved. So I think it's not just about describing a wonderful idea and trying to put it into place. You have to have the tools necessary to achieve that. And workers, of course, are fundamental. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot.